Welcome to the program. I'm your host, Neal Howard. Thank you for joining us here on Health Professional Radio today. Our guest in studio is Dr. Kimberly Cress. Now, Dr. Cress is a psychiatrist and founder of the TMS Serenity Center in Sugarland, Texas. And she's here with us on Health Professional Radio today to discuss the field of transcranial magnetic stimulation and neuromodulation. Welcome to Health Professional Radio, Dr. Cress.
Thank you, Neal.
Thank you. You're the founder of the TMS Serenity Center in Sugarland, Texas. What exactly is TMS, or transcranial magnetic stimulation?
So TMS is a new and innovative way of helping to treat depression. We use the term neuromodulation, which is a hefty word, but basically what we're doing is an in-the-office procedure for treatment of depression where individuals come in and we place a MRI strength magnet. And that magnet is localized to stimulate an area of the brain that's involved with mood regulation. So we are trying to target the dorsolateral prefrontal cortex, if you will, the left front portion of the brain. That's, again, the area involved with mood regulation. And as this magnet pulses over a 37-minute period of time, that magnetic field will actually stimulate electrical current in the brain. And when you stimulate electrical current, nerves will then fire. And as nerves fire, they release neurotransmitters or chemicals such as dopamine, norepinephrine, and serotonin. Those are neurotransmitters that we're providing artificially through antidepressants. Antidepressants that individuals typically think of, for example, Prozac or Lexapro or Effexor. We are able to help facilitate the release of these neurotransmitters directly into the brain to help in treating depression. And what's so exciting is we have the opportunity to make changes and help individuals in their treatment of depressions in ways that they've never been able to see responses with medications.
You're stimulating an area of the brain with this magnetic field. How do you ensure that only these mood-regulating areas of the brain are affected?
Well, through making various measurements of an individual's head, we can specifically locate the area of the brain, again, the dorsolateral prefrontal cortex, and place the magnet in that location. It's similar to if an individual was going in and receiving an EEG, where they place and looking for the electrical activity of the brain and place little stickers, if you will, onto the head. We know where we need to place those stickers in order to find what's called the F3 in doing EEGs. That's the dorsolateral prefrontal cortex. So we can target that area of the brain. But what's exciting is not only are we stimulating just that area of the brain, but as one nerve gets another nerve to fire, we can actually then facilitate stimulation in the inner parts of the brain, what we call the subcortical regions of the brain. So that would be like the hippocampus, the thalamus, the hypothalamus. Again, those are areas that are involved in mood regulation. So as one nerve gets another nerve to fire and stimulating these inner parts of the brain, we are also facilitating changes within circuits. TMS helps the brain rewire itself to getting relief of the depression. And so we're not only making changes in the neurotransmitters, but we also help make circuit changes. And the idea is circuits that fire together wire together. And so we know through various studies that have been done that when individuals are struggling with illness of depression, that in certain regions of the brain, for example, the hippocampus, neurons will shrink or atrophy. And we can facilitate regeneration of these neurons from various treatments like neuromodulation. Now, this regeneration of neurons can occur through medications. It can occur through exercise as well. But TMS is one of the fastest ways to help facilitate this neurogenesis. Again, important to help individuals get their life back and get some relief from their depression.
How often is TMS used in conjunction with, as you say, these drugs or various exercises?
So I have been a provider of TMS since 2010. The vast majority of individuals that will come to me are individuals that have struggled with depression, not just for a year, but oftentimes decades. And through the years, they've been on various medication trials. And so they find themselves having maybe some relief from the depression, but still not getting complete remission from the depression. And or they might find themselves really struggling with side effects from the medications, that it really limits their ability to get relief from the depression. So most individuals I find will come to me on some type of medication regimen, and it may not just be one medication, it may be multiple medications, and again, still struggling with the depression. We can then add on TMS to their current medication regimen with the goal of, again, getting them, remission or complete relief of the depression. But the even longer-term goal is not only getting them that relief, but to help facilitate if we can simplify their medication regimen down the road, so that they are on less medications and therefore less risk of side effects.
What about any discomfort or pain? Is there any discomfort associated with TMS?
It's a great question. So patients come in and they will describe as the magnet is pulsing, and it's like similar to Woody Woodpecker, if you will. So it's a little tapping that's there. That tapping is something that they quickly get used to or desensitize. So they find themselves, the first day or two, they notice it, and then they find themselves getting distracted by conversations as the treatment is continuing on, or they may watch TV, listen to music, and they get to the point where they just completely ignore it and they know what to expect with it. Individuals may have a transient headache as they're in the process of getting used to the medications, but thus far I haven't had anybody who couldn't tolerate the treatment.
Now, you mentioned early on that this is a new type of depression treatment. Are we talking about something that we're going to wait years, down the road before the, research and development drops the cost, or is it relatively inexpensive now? What about the cost of this treatment?
Well, the cost can be variable, certainly, between clinics and, where you're receiving the treatment within the country. Cost of living, providing services, et cetera, can play a role on that. But what we are seeing, TMS was FDA cleared for treatment of depression in 2008. And so over the years, we have seen how insurance coverage has increased vastly, that now major insurance companies, TRICARE, Aetna, Medicare, and most commercial insurance plans are helping to provide insurance coverage for TMS, that it helps to minimize that economic cost for receiving the treatment.
Where can we go and learn more about TMS and the TMS Serenity Center there in Sugarland, Texas? So
to find out about the TMS Serenity Center, best way to find that information is going to our website, so tmsserenitycenter.com.
Okay.
But if we're located in the Houston area, if you're not in that vicinity, individuals can go to neurostar.com in order to then search for a provider in your area to find individuals that are TMS providers.
Well, I appreciate you coming in today, Doctor.
Thank you.
Thank you. You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio with Dr. Kimberly Cress, founder of the TMS Serenity Center in Sugarland, Texas, and she's been with us in studio today discussing Transcranial Magnetic Stimulation, or TMS. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.